Greek healthcare professionals who volunteer with Doctors of the World are normally on missions abroad, in Africa or the slums of South America. But for months, these doctors have been working in a clinic 12 kilometers from Athens, in the port city of Piraeus. Stefanos Spartinos is diabetic. The clinic provides the care he needs to manage his condition, be it blood sugar tests or new prescriptions. The 56-year-old has nowhere else to turn.
Without Doctors of the World, I'd already be dead.
Medications for chronically ill patients like Spartinos come from donations. Those unable to pay for treatment can no longer turn to the government. Doctors warn that the national healthcare system needs €1.5 billion to avoid collapse.
Now that we are in a crisis, we realize that we don't have a real social state. So now we see that, for example, for the handicapped people, is nothing. Some of them, families with handicap, they took some money from the state and everyone was quite happy. Now that the money are out, is nothing.
Those who are able to pay their debts to the tax office but are still poor are issued a pass entitling them to health care. Those without the pass are left with two options: getting help from the church or initiatives like Doctors of the World. A third of the Greek population is no longer covered by the national healthcare system. The situation is critical, and it's not limited to the poorest of the poor. Dialysis, cancer, and AIDS patients, as well as families who need routine medical services, no longer have access to health care. The Athens Medical Association says that the country faces the risk of a pandemic.
Als Kinderärztin muss ich Ihnen sagen, dass immer mehr Kinder.
As a pediatrician, I can tell you that more and more children are going without basic immunizations. Many parents can't put food on the table, so they don't even consider immunizing their children because that costs money.
Die übrigens auch gezahlt werden müssen.
Hospitals also face a dilemma. Large pharmaceutical companies no longer deliver drugs. The Greek government owes them €2 billion. There's a shortage of essential items like syringes, vials, and gloves. Operations have already been postponed. Miran Fasolakis has worked for more than 20 years in the surgical department of Athens' Elpis Hospital. He has never experienced such dire conditions.
It's really bad. It is bad when a doctor can't help patients who are sent to him with the necessary treatment. I've reached the limits of my strength. My salary was massively cut, and in the last 9 months, I've done overtime without pay because there is no funding to fill new positions.
The next trouble spot of the ailing system is the pharmacy sector. Pharmacist Georgia Psautoulia has not stocked all the major drugs for a while now. She would be bankrupt if she did.
The pharmaceutical companies want payment in advance. I had to take out a loan for some of the more expensive cancer medication. The state health insurance reimburses me months later, when they pay it all.
Stefanos Spartinos and his wife now live with his sister. They couldn't afford their own rent. The unemployed diabetic could not afford even 1 week's medication. When friends and family get together, the conversation often turns to the plight of Greece's chronically ill and how they can survive the crisis.
I don't know what will happen. I'm not only suffering from diabetes, I also have problems with high blood pressure and some mental health issues. Look at my foot. That's from diabetes. I need an operation, but I can't afford it.
Stefanos Spartinos is just one of millions of patients in Greece who can no longer expect help from their government.